Top 5 reasons that an Indian diet and lifestyle causes obesity and diabetes. My name is Dr. Rawat. I'm an Indian origin, England trained, Canada-based physician who studied nutrition at Harvard, founder of website weightlossgroupcoaching.com, and currently writing a book on how to lose weight and reverse metabolic disease. The background is that currently I'm on holiday, which is why the background of this video looks quite different to the usual background of my videos. I'm in India, meeting up with family, friends, and I really can't help observe all the obesogenic items that I see around me, and I would like to share my observations with you and advise you on the top 5 reasons that an Indian diet and lifestyle is obesogenic and also predisposes to metabolic disease like diabetes. I'll go backwards from number 5 to number 1. Make sure you watch till the end because number 1 may surprise you. But first, we'll go for number 6. The reason I haven't put this in the top 5 is because it's a non-modifiable risk factor. It's something that you can't change. But we can't discount the importance of number 6, and that is your genetics. In my coaching sessions and also in my book, I talk about the thrifty genotype hypothesis, which is a hypothesis which was postulated by James Neal, a geneticist in Michigan. And in this, he talks about why certain populations, particularly South Asians, Filipinos, Latinos, natives, are predisposed to metabolic disease. They are more predisposed to storing fat around the abdomen in the more metabolically active and dangerous locations like around the belly, in the liver and pancreas, in preference to more safe locations like the subcutaneous layer. And this is because of repeated famine and feast cycles. This is because they have been adapted through Darwinian evolution to be better survivors of famines and hardship and scarcity of food. And it is this storage of energy around the belly which makes them better survivors of famine. But unfortunately, this is a short-termish genetic approach. The genes are preferring short-term survival over longevity. And part of my coaching and what I advise on my book is how we can reverse that, because it takes thousands of years for genes to change. But you need to adapt in a way that you can attain longevity even though you haven't been gifted the most longevity genes. At number 5, I notice in certain subsets of the population a predisposition to not do resistance exercise, particularly weights. Whenever I talk to clients about the kind of exercise they're doing, they often talk about yoga, they talk about walking. And while cardio and isometric exercises do have a role, and of course are better than not exercising at all, I would like to see much more take-up, not just in the metros, but also across the country, of resistance exercises, weights, and not just in men, but also in women. Because I speak about the twin cycle hypothesis of how diabetes and metabolic illness occurs, and there are primarily 2 locations of insulin resistance that develop in a person who has a genetic predisposition to this, and this is muscle insulin resistance and liver insulin resistance. To reverse the insulin resistance within liver, you need to get rid of the fat, while to get rid of the insulin resistance within the muscles, you need to increase the bulk of muscles and increase your exercise. And so resistance training is really important when it comes to reducing insulin resistance. And I would like to see much more take-up of resistance training. Of course, keep doing your yoga and walking, but we need to add weights into the picture as well. At number 4, I would put in a tendency to working too hard, which means working in a way which messes up your circadian cycle, which means you're working till late at night, you're having dinner late at night, and you're not able to observe life in a circadian way. In my coaching and in my book, I talk about circadian fasting. I, for example, would eat breakfast 1 hour after getting up. I would get up with sunrise and I would not eat for 14 hours before that. So as an example, if I have breakfast at 8 a.m., I would ensure that I do not have any food after 6 p.m. Water only, or perhaps lemon water or green tea after 6 p.m. This would match your calorie intake with your activity levels, with your hormone levels, and I have done extensive videos on a circadian life and a circadian fasting. And particularly here in India, I see quite significant disruption of a circadian cycle, which messes up hormones and predisposes people to excessive weight gain, storage of energy, rather than utilization of energy, which ultimately is the root cause of metabolic disease. At number 3, I would put excessive consumption of refined ultra-processed grains. Every street corner you see halwais and sweet shops. Whenever you're offered snacks, you get biscuits or some kind of Indian snack. And these are all factory-made, ultra-processed refined grains. Even when we're eating food, what people do not consider as mithai or sweets would be white rice or white naan bread or white bread. And in my book, even these are processed refined grains. In my diet plan, I recommend whole intact grains such as millets, brown rice, and if you do have to have bread, certain types of bread such as a sourdough bread with flax seeds, for example, would be preferable to your standard kind of a bread. So if there's one advice I'd like to give my clients in India, you need to look at the consumption of refined processed grains and reduce that. At number 2, I see way too much frying of food. Now, as soon as someone starts making food, whether it's at home or in a restaurant, the first thing you see is a whole lot of oil at the bottom of the pan being boiled, and that's how the food is going to be prepared. And what I remind people is that this is how we were cooking decades, if not centuries ago. If you go to my village in the hilly, remote parts of the Himalayas, and if you go to a party, then you will see big pans of boiling oil and all the food is being thrown into it. But in the olden days, we did not have refrigerators, we did not have air fryers, there were no microwaves or ovens or slow cookers or steamers or instant pots. And we were reliant on this old-fashioned way of cooking, plus the food needed to be sterilized. And the only way to really sterilize food in those days was to throw it in the fryer and fry it. We need to now move with the times, with the science, and we need to use these modern appliances to be able to cook food in a manner which is more healthy. When you fry food, even good food, let's say you're frying fish, gets turned from good to bad. You turn the polyunsaturated and monounsaturated fatty acids into saturates, which are unhealthy for you, which will increase your blood cholesterol and increase risk of heart disease and cardiovascular disease, and also increase fatty liver, and through fatty liver, increase insulin resistance. So one thing we need to do is adopt more modern cooking techniques and limit and reduce the frying of food. On my diet plan, I do recommend one cheat day, generally on a Sunday. So if you want to fry your pakoras and samosas, do it on a Sunday. That's fine. I'm not asking you to live the life of a hermit or an ascetic, but 6 days out of 7, you should be eating for your health, and 1 day out of 7 can be a cheat day. And now to number 1. And this might surprise some of you people, but The number one biggest health problem that we have in Indian food culture is excessive use of ghee, butter, and oil. Now, oil we touched upon at number 2 when we're talking about the frying of food, which needs to be reduced. But excessive use of ghee and butter is a big problem. Firstly, because it's a solid fat, so it contains saturated fat, which will increase fatty liver and blood cholesterol and risk of heart disease. But secondly, even if you were to believe all the misinformation that is in social media about the benefits of ghee, and I was looking at some advertisements and hoardings on my way here, and they even now have a ghee-based skin cream. Ghee is considered to be so pious and so sacred here because, we Hindus believe that our cow is a sacred animal, so anything coming from a cow is bound to be good. But unfortunately, the science does not support that. Just like eating a cow is not healthy, similarly, particularly for people who have gone past the age of 20. Now, I do recommend cow's milk for growing children because it's been shown to increase height because it contains insulin-like growth factors. And of course, children are growing. They have a brain that's growing, a nervous system that's growing. They need a lot of fat. So I'm completely okay with ghee, butter, and cow's milk for children up to the age of 20. But once you get to a certain age, these foods which contain a lot of saturated fat and also insulin-like growth factors can have detrimental effects. And I have in fact done a whole video on the detrimental effects of cow's milk and red meat. But let's say that for a moment we even believe all the misinformation which talks about the so-called benefits of ghee. At the end of the day, this is a highly calorie-dense food. If a tomato has a calorie density of 150 kilocalories, then oils and ghee have a calorie density of something like 8,000 to 9,000 kilocalories. By adding 1 spoon of ghee, you might as well have added 8 or 10 apples to your plate. But that 1 spoon of ghee gives you virtually no satiety in return, while eating fruits, green leafy vegetables, whole grains, lentils would give you a lot of satiety in return of the calories that you're getting. In addition to that, you will also get fiber and nutrients. Now, like I said before, if you believe you need to have ghee because you need more fats, well, you could get it through healthy fats, what we describe as polyunsaturated fatty acids. You can get that in nuts, seeds, olives, avocados, small amount of plant-based oils. Of course, you have to be careful with oils because if you fry it, you make it bad. Also, it is high in calorie density. But eating ghee and butter for adults past the age of 20 is just going to cause obesity. And remember, ultimately, what drives obesity is at the core our energy balance problem, too many calories coming in, not enough calories getting utilized. And it is that storage of energy as fat within your liver, your pancreas, which in turn causes insulin resistance and the development of everything that we describe as metabolic syndrome, be it fatty liver, insulin resistance, prediabetes, diabetes, low testosterone, obstructive sleep apnea, heart disease, strokes, sexual dysfunction, circulation problems, etc. So that ghee that you're eating and you've been told is super important for you is actually a big contributor in all of your metabolic and weight-related health problems. So in my house, our kids get ghee once in a while, but my wife and I, we don't eat ghee. My children get cow's milk because they are under the age of 20, but me and my wife, we drink soya milk. And I don't believe that adults, generally speaking, need to have butter, ghee in their house. Even on the topic of oil, you should be trying to use as less as possible. In my house, we use the oil spray. And sometimes if I can't find the spray, then I will put a few drops on the pan and use a barbecue brush. You spread it around so it's a very thin layer, and we are using as less as possible. Add more water beforehand, cut more tomatoes, put a pan on it, use steam primarily to cook it, not the frying action, and you will see a significant reduction in calorie intake, and that will solve a lot of your weight and metabolic health problems. So I hope you like this video. Consider subscribing to the channel. Check out the website weightlossgroupcoaching.com. I am writing a book on how to lose weight and reverse metabolic disease. It should be out in a few months' time. Until then, I'll see you again at the next video. Are you tired of endless weight loss and weight regain cycles? Do you finally want to make that permanent, lasting change? If that's the case, I've got fantastic news for you. I'm Dr. Rawat, a clinician with over 25 years of experience who studied nutrition at Harvard, founder of weightlossgroupcoaching.com and the Set Point Reset diet plan. The reason that crash diets don't work in the long term is because you haven't hormonally reset your set point. Your metabolism slows down and your body fights you to get back to the old weight. So before you subscribe on that next crash diet, click on weightlossgroupcoaching.com, and over 8 Zoom group video sessions, I will coach you on how you can use various strategies to hormonally reset your set point so that you not only lose weight, you also maintain your weight loss. I look forward to seeing you there.